Thank you, William. Thank you, Jackie. So my name is Preeti Sud. I work in Mid and South Essex Foundation Trust as Head of Strategy Unit. So as you can see, I'm not from Workforce. However, the work on Anchor program within MSc FT and MSc Health and Care Partnership is being led through our team within the hospital. And I have a few slides to share just to give you a bit of practical examples of what we've been doing, something which I think is a little bit different. But before that, I thought one of the things that most people ask us is how did we arrive at this as a solution? You know, why did we start thinking about Anchor? Why did we start thinking about specific aspects of Anchor? So I think over the next 5 minutes, I'll spend some time trying to take you through our journey and then share the slides, if you bear with me. So as I said, I work in the strategy team. Charlotte Williams, who's our director of strategy, in June of 2019 got involved in the work that Health Foundation was doing at that point in time, trying to gather evidence around anchor institutions and what would it mean for NHS to be anchor institution. And the work got published, as you know, in a report in August of 2019. When we looked at the evidence in June, July, we were thinking about what would it mean for us as a foundation trust. And from a contextual perspective, I mean, if you've been here since morning, you realize this is all, context plays a big role. So from a contextual purpose, Mid and South Essex has a population of 1.2 million. We are somewhere between London and Cambridge, if you know, from a geography perspective. We have 12 districts, multiple district councils, a county council. We used to have 5 CCGs, now it's 1. We were 3 district general hospitals, Basildon, Southend and Broomfield, and we merged on 1st of April 2020. So in 2019, we were working as a group of hospitals, a hospital group. Most of our population, like in many parts of England, is between the 16 to 64 age range. So 60% of our population is in that age range. 16% of our population lives in rural area. 3 specific districts have higher deprivation than the England average. So Basildon, Southend-on-Sea and Thurrock. We as a population are 11% ethnically diverse. However, that changes. So across Mid and South Essex, it's 11%, but in Basildon and Thurrock, it's more, much more. And also it changes when you compare the ethnic diversity of our own staff within the hospital. So we are more ethnically diverse as a hospital staff compared to our population. As one of the biggest employers in Mid and South Essex, we employ 15,000 staff. It would be around 17,000 because not everybody works full time. So around 17,000 individuals, but across 15,000 posts. So I hope that gives you a little bit of background of where we are coming from. And as with most of the stuff, we started looking at our own data, and I'll share something with you in a bit. And we then took that data and engaged with our own kind of directors of nursing to try and understand what is this data actually telling us about our own staff, about our own workforce. We also explored, had some exploratory conversations with our partners. So being in strategy team, that's one of the benefits that we get. We get to do a lot of exploratory conversations before we do anything, embark on a program of work. And in October of 2019, we brought both internal and external stakeholders together in a room. That was a different world, as you can imagine. We had 30 people in the same room. I miss those days. And this, when I say internal stakeholders, I mean our own HR team, organization development team, estates, and facilities. So various departments within the organization, plus partners like the councils, community and voluntary sector, CCG, primary care, other, the wider partner group. And we asked 4 questions. One was, what do you think about Anchor? Does it make sense to us, as a big group of stakeholders? People said, yeah, makes sense. Question number 2, if that makes sense, does it make sense for us as a hospital group to lead on this piece of work? Because obviously, councils know more about social value. And everybody agreed that yes, it made sense for the hospital group to lead on it. Then there were various reasons for it. We, as I said, one of the biggest employers. We are, as you know, Anchor is about that sticky capital. So we are that big building on top of the hill or on Prittlewell Chase in Southend. So yes, it makes sense. And we have a good reputation at a place level. Question number 3 and 4 are like A and B. So it's, yeah, so if those two things make sense, which place, where should we start? It's like, if you're going to do an experiment or pilot it out, where do we do it? In a place and in an area. And because of various reasons, and some of it was what our local need is within the hospital, within the locality, and also being a bit opportunistic, we arrived at employment as our main, our workforce as our main focus area, and Basildon as the place where we will do this. And I'll show you some data when I flash the slides around why Basildon and why employment. And that is the start of the program. So October of 2019, hospital as an anchor institution, focusing on Basildon and in workforce as kind of our focus area. That is where we started. So by Feb of 2020, we went around, spoke to our directors of public health in various councils, and some of the other partners who put their hands in their pockets and said, yes, here you have some funding, let's start, let's do something, let's look at something very tangible that we could do as a partnership to try and understand what would it actually mean to be an anchor institution, and what would it mean for NHS to lead that bit on behalf of various partners. And then March of 2020 happened, rest is history. However, July of 2020, we realized that there was a lot happening at a place level and we couldn't keep the anchor institution work paused. We had to revive it. So since July, August last year, we've revived the anchor program after it went for a pause in March of 2020, and we have delivered. And I'll show you some numbers in terms of what do I mean by we have delivered. And the partnership has become more stronger. We've got more people around the table, departments of work and pension, more engagement from our community and voluntary sector organizations since July 2020. So lots of positive has come out of the pandemic for the anchor program. And as I mentioned earlier, it is about internal and external stakeholders, and anchor is a team sport. So whatever I'm saying here is on behalf of that team, which is sitting kind of supporting us doing this. We started without a budget, with me and Charlotte thinking about, yeah, this is like, 0.01 day of our life in a week. And it has grown. We've managed to get almost £250,000 into this program. We now have 2 team members who are supporting, kind of part of the anchor program team. One of them started this week, one started last week. So that's the kind of journey, and I would say it is a 15-month journey because we've kind of paused and started and paused and started. So that's where we are. If I could quickly share my screen, and William and Gweno, please shout out if I'm taking more time than I should.
You got a few minutes left, Preeti.
Sorry, William?
You just got a couple of minutes left, so keep going.
Okay, perfect. So very quickly, the anchor program, this is what it includes. It includes widening access to quality workforce. You would have seen all of this evidence. And so under, how do you build your future workforce? How do you widen participation? How do you be a good employer? But these are the other bits. So we also have another bit around environmental impact, etc., which we're not talking about today. And it looks very neat, but trust me, it is not neat. This is what it looks in the background, because this is all about connections. As I said, it's a team sport and it's about partnership and connections. This is the dashboard I was talking about. So the workforce, we built this workforce dashboard. We took it to our dons to say, we have 60% of our staff who work locally in Basildon and live locally in Basildon, who live in the bottom 2 quintiles. What does that mean? And what can we do as an employer? So this is the third aspect of being a good, the third evidence based around being a good employer. And we soon realized that some of it is because we have specific ethnic communities that live in those areas. Some of these areas are in walking distance to the hospital, so cheaper to travel, cheaper to rent. So that it's a quid pro quo. So if you are in a low paying job, it's easier for you to live in one of these areas, not because you want to live, but because it's cheaper and easier to travel, and it supports your earning and your kind of family's living chances. But then it has a negative impact on life chances of our staff. So we were exploring this, and one of our partners, Anglia Ruskin University, we went to one of their sandpit events, which is kind of an innovative way of saying this is a problem question, what should we do? And what we came out from there is we have co-commissioned, so Anglia Ruskin and us have put money in a small pot where we are doing two pieces of research. One is an ethnographic research, trying to understand what does it mean for staff who live in Basildon and work in Basildon. What does it mean? What are the dynamics that affect them? And then we're going to use, and we've started conversation with our council partners around how do we use this to develop, feed into some of the work that councils are doing around safe traveling, active traveling, street lights, greenery, etc. And what can we do so that we're not only talking about or thinking about our staff once they enter the corridor of the hospital, we're talking about their kind of life chances as a whole for them and their family. And the other piece of work that came out of this was around trying to understand what does it mean to be an employee and an informal carer, and what could we do at a policy level, how do we run our shifts, etc., to support our own staff. So these are the two pieces of research that came, kind of pragmatic research that have come out of that piece of work. And then the second piece, I mean, there are lots and lots of examples, but the second piece which I wanted to highlight was around the future workforce. So there's lots happening around our work with DWP to recruit at system-wide initiatives. Jackie mentioned a few where we are recruiting on behalf of the system because it's easier for us to kind of market a job and get health and social care workers rather than a care home or a GP surgery. So we are doing that on behalf of the system, and there are lots and lots of system-wide initiatives on recruitment and retention. But we thought there was this place where we could have some positive influence, which was building the future workforce. And when we looked at Basildon data, we saw that Basildon as an area had low aspirations compared to the whole of Essex and even England. So we were trying to understand, so what do you do with it? And within the strategy team, we also host the Mid and South Essex Innovation Program. So we run Innovation Fellowship where we have amazing innovations that come and want to work with us. And one of the fellows, Dr. Hina Rafiq, had an innovation which is called Generation Medics. It's an online platform which helps engage and provide support to help widen participation in health and care careers. So children who would have never ever thought about health and care as a career, or even going to university or studying further, I engage in this online platform, and they get mentoring support, they get support with CV writing, applying to universities, etc. And when we started this piece of work, there were kind of face-to-face career workshops, which then very soon got converted to virtual career workshops. And the program is also running a virtual work experience placements for children from Basildon schools. And over the last 6 months, so we restarted it in August, and by March, we had 300 children engaged on the platform, 80 of them who then got into the paid version, so the kind of more support online, and 45 children who have been placed in a virtual work kind of placement within the hospital or within a service. And that's not the only piece of work. We're exploring how we can take this further with pupil referral unit, some of the work we are doing with youth who attend A&E, how can we link this into that program as well. And we're also looking to work with a local college and learning from the work that Essex County Council did around supported internship for young adults with learning disability. So they come on board on a 12-month internship and are placed in various services. And it's not about what they will get out of this. I think for us, the bit is what will our services get out of this? Because I think this is an opportunity where, while we are supporting interns with on a learning disability spectrum, we're also helping our services understand how to be more inclusive and how to work more inclusively at a service level. So as I said, just a few examples, not extensive, and I know I've overshot my timeline, but I shall stop sharing my screen now.